AskReddit by Fallout Battle. To Americans who are against free healthcare. Why? Probably cause our government is notorious for handling things poorly. Also cause it would most likely be reversed when someone else takes over. The funny thing is, because some states in the US require health insurance, we already do pay for universal healthcare, only at a much higher rate, and through private industry. People just don't realize it. And while a middleman rakes in profit from it. I feel like a lot of people in this thread taking the word free in healthcare too literally. Free in the same sense that the government is free, so is the armed forces, and the police. You don't pay extra to use their services beyond the tax you've paid. Edit. I'm bored of replies that don't understand the concept of a free at the point of care healthcare service. You don't pay extra to use it when you need to, but you pay taxes to maintain it. No one thinks a trillionaire sum here is funding entirely cost-free healthcare in countries with free healthcare. Unless you're in some places in the Middle East where it's almost true. Redditor answers question. Downvoted. Told why they are wrong by other redditors, quite a few who are non-American. We really need to stop downvoting people who actually answer the question. It's the worst in type subs. ARPs almost never respond in the comments, or if they do they'll get one or two comments downvoted to oblivion and stop. We have Medicare, Medicaid, and the VA, which are all government supported healthcare. All three provide some of the worst healthcare options I have ever seen. It's kinda hard to trust the government then to say they can take care of me when they can't take care of the old, poor, and the veterans. There's always so many misconceptions that happens in these threads. 99.9% of Americans agree that healthcare needs overhaul. I just can't believe there are people in the US that trust our government to do anything correctly. Who else does it though? I certainly don't have an answer. Deleted. I want universal healthcare, no such thing as free healthcare, but I want a healthcare reform beforehand. Our healthcare system has some real issues and scum behind it that needs to be addressed before we could even get a real universal healthcare plan in place. Free refers to free at point of access, meaning you never get a bill or have to pay for any specific service. We all know it still needs to be paid for. The VA system is what free healthcare would look like in America. Not sure that's an improvement, plus the government never does anything remotely cheap. Fair point. However, why do we have to mimic it after the VA? Can't we look to countries that do it correctly? Norway, UK, etc. and take what they do right, fix what they do wrong and provide something better? I find it interesting that we will point out all the negatives that happen in the UK for their healthcare, but not focus around the positives. We don't need to fix us healthcare in a vacuum and can use already well established examples on how other countries do it to build off of. I lived in the UK where NHS was in essence free healthcare. As an expat I had to have private insurance. I got in to see the doctor immediately because the doctor had a policy of treating his private clients first and then just going home for the day. NHS paid him so little for treating people for free, he'd rather get nothing and use the free time. It's the same reason why Canada is losing doctors to the US. The government is a good example as to why the government isn't trusted to run things. Free downvotes for anyone who answers the question honestly. I've spent half my life in both Canada and Texas. The overall inefficiency of the Canadian systems leaves such a sour taste in my mouth. My mother's life-saving prescriptions cost more in Canada than they did in Texas with employee benefits. I have been put on multiple 6+ month-long waiting lists in Canada for other simple issues. Don't forget, almost everyone I know is already paying for Blue Cross on top of what they already pay in taxes. Tell me how that's free? Blue Cross is insanely expensive. If Canadian healthcare is free, why does everyone pay for a separate healthcare package? Madness. Nothing about it is free. I'd much rather obtain benefits through work and receive immediate care like I did in Texas, than to feel like a cog in a government machine every time I step into an emergency room. It has post office vibes, a bunch of government workers doing the bare minimum. You're more likely to die waiting in Canada than you are to actually receive care, it seems. I also have had experience in both kinds of systems, and am far happier with employer-provided coverage where I live in Texas. I pay $130 a month for insurance. That covers a family of 6 for health, dental and eye. $20 copay, $30 for a specialist. Longest I've waited was 2 weeks. I think population density could be a factor. I live in the middle of a bunch of major metropolitan areas, so there is no shortage of specialists. Is this with a tax credit or state program? Or your job just provides really good coverage? I pay $150 a month for one person. A family of 6 seems like there is someone else footing the rest of the bill. I live in a major metropolitan area and there are no shortage of specialists. The problem is finding someone you like who takes your insurance. As someone living in a country that has free healthcare, it sounds great, but be prepared to wait 4 years for your appointments. I had a dermatology appointment that was 2-year wait. My mother had a hernia and she had to wait for hernia surgery for 3 years. That is free healthcare. Of course, if you decide to pay for healthcare, you get treated very quickly. Who would have thought, right? This is my concern. When it starts affecting my ability to see my doctors, then we have a problem. I've seen stories of government denying coverage for procedures or taking a long time, in comparison to America, to actually perform the procedure. I'm also not a fan of giving government more power and authority over individuals. Insurance companies also deny coverage, no? Government incompetence and inefficiency. As a Canadian, let me tell you how proud I am of our system. I've only had to wait 7 months, so far, to see a specialist about my herniated disc. I'm sure I will get a call any day now to get a 5-minute consultation a few months after that, to then plan an operation another few months, years after. But hey, this nothing I'm getting is free. Well, my tax dollars are funding it, so who's to complain? Also, I haven't had a family doctor since, maybe 2015 or so. Glad to see another Canadian so I didn't have to start a new comment thread, lol. Also have no doctor and haven't been to one in years. Took 3 weeks for my wife to get a call back just to get a prescription renewed. Glad all those taxes we pay are going somewhere, but it sure doesn't seem to be to healthcare. I am in favor of universal healthcare but have one hang up. I believe healthcare should be accessible and affordable. People shouldn't be dying because they're rationing insulin or skipping blood pressure meds so they can afford groceries. That's a major failure on our collective part. That said, I work for the federal government and have seen how poorly some programs are administered. I've also read plenty of horror stories about the VA's quality of care. I also have first-hand experience with how slow and clumsy government can be in adapting to new circumstances. See the state-level legalization of marijuana. I live in a legal state. My agency policy still identifies MJ as a dangerous narcotic. Drop a hot pee test and I'm fighting for my career. I don't know what the answer is, but what we have now isn't it. As a whole, the American healthcare system is complete shit. I do not have health insurance. My employer offers it at just over $500 a month. Mind you, I'm single and healthy in my 30s. That's insane. But get this, last year I had to have an emergency appendix removal. The total of that was $30,000. No insurance here, so I was self-pay, which knocked the total to $13,000. Then I could pay in cash the full amount, so they took $5,500 fine, paid the $5,500 and washed my hands of it. But then I got to thinking, if I had insurance for 1 year, I would have paid $6,000 for that year of insurance, plus the $1,500 deductible. If I had that insurance, I would have paid more for the operation. Stop calling it free. That's probably part of the problem. Call it Singlepayer. Call it Medicareforall. But don't call it free. It won't be free. Nowhere in the world is healthcare free. Free quality. Not to mention, free equals you pay more taxes. Two arguments here. 1. I already get healthcare through work, and I find it highly unlikely that my income would go up more than my taxes. It's only $30 more opt out for my company, i.e. me personally would be at a net loss. 2. I don't trust the government at all to handle my money. They are trillions of dollars in debt, and if there were any other business, they would be bankrupt. I'm not against the idea of free healthcare. I just don't see a plausible implementation currently that would put me in a better spot than I currently am. I think the best argument against free healthcare is the loss of the profit incentive. Drug companies are competing to achieve massive profits. The incentive to design better drugs is more money. While America does not have the most accessible healthcare, we do have one of the most advanced medical research systems. We have to replace the money incentive, or at least temper it before we can go to universal healthcare and maintain the high caliber of our medical research industry. The majority of drug research and design is publicly funded. My friend in the UK died waiting for weeks to see a doctor. Not a perfect system, but better than nothing, I suppose. I'm not against it exactly. I'm just against it with our current governmental processes. We couldn't get Obamacare off the ground and operational without killing our cheaper, more efficient private healthcare. Everything they do is full of pork, kickbacks, and these derelicts lining their pockets, not to mention just plain piss poor oversight. Nobody wants you to have a conversation about the wait times in these other advanced countries with UH. Because there is no such thing as a free lunch. How much is your life and health worth to you is a pretty scary question. How much is your life and health worth to the government is way scarier. Because the US government will fuck it all up worse than it already is. People act like our government can actually run something that large and important. They can't run it. The US government already outspends literally every other nation on the planet with healthcare spending, and due to corruption at every level we still fuck it up. People act like our government won't find a way to cheat us more than they already are. Because the government is corrupt and easily captured by special interests, it would just turn into a big scam. Better to break up the insurance companies and decouple them from the healthcare industry if you want to see meaningful cost reduction in healthcare. Better to encourage more competition in healthcare to bring costs down. It's a cartel right now with predictable results, high prices, price gouging, etc. Free healthcare would mean it is paid for by government or some other huge enterprise that levies taxes or other charges that are not directly related to healthcare consumption on the citizenry. So it is not free, it is just paid for by a general tax rather than individuals paying for episodes of utilization. One thing wrong with this is some persons will abuse $0 access to care. Some of us are hypochondriacs or anxious or have other psychic issues that would lead to repetitive and non-helpful requests for healthcare intervention. If the cost to an individual is truly $0 free, then the system will be abused. There has to be some way to limit such non-productive use so that others who are truly ill can get the care they need. Such strategies do exist, but the hypochondriac faction will not be happy. Another problem will be the ongoing need for the sponsor, government or whatever, to actually allocate adequate funds to support the enterprise. There will always be competition between other projects and healthcare for tax dollars, and it is possible that healthcare will be starved of income and wither or collapse. If one doubts this, read about the once vaunted National Health Service in Britain, and its fall from grace. Source: worked for a healthcare system for decades in which many paid $0 for each healthcare interaction.